Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. In this special occasion, I would like to present about qualitative and quantitative analysis. My name is Fannisa Balqis Astiani. I am the second semester student Medical Record and Health Information Department. General concept. Here, I would like to present some information related to general concept of qualitative analysis. Qualitative analysis is a review of findings in medical records relating to consistency, and its content is evidence that medical record is accurate and complete. Qualitative analysis component. 1. Completeness and consistency of diagnosis. 2. Completeness and consistency of diagnostic record. 3. Records and the time of care and treatment. And last, review for the necessary informed consent. General concept of quantitative analysis. Quantitative analysis is a study or review of certain section of the content of medical record, with the intention of finding specific deficiency related to medical record recording. Quantitative analysis is an analysis in the number of sheets of medical record according to the lack of treatment, including the completeness of medical sheets. Quantitative analysis component. 1. Identify the correct patient on each sheet of medical record. 2. Important reports. 3. Authentication. And last, good and correct documentation. Case analysis. First, the qualitative analysis from medical diagnosis. You can see that there are some points that should be critically analyzed. In this point, case of qualitative analysis about medical diagnosis. Here, in the template is medical diagnosis. Medical diagnosis of acute bronchitis. Description of the diagnosis: patient has acute bronchitis, which is caused by a viral agent. The blood test does not indicate that it is bacterial infection. Medical active or prescription. Take analyze or paracetamol for fever. Drink a lot of water. Take vitamin C. Get enough rest and sleep. And eat fruit and vegetarians. This is most appropriate and consistent because consistency and completeness in an adjustment or a match between one part with other parts we hear from the start of the notice development. Doctor instruction and group record must be consistent. Second, we are going to have case of quantitative analysis. A 41-year-old man who recently immigrated from Africa came to the emergency room with abdominal pain. The patient primarily spoke Tigrinya, and an interpreter was used in taking a history. The patient's abdominal pain had started 4 hours earlier, which he described as squeezing or cramping with epigastric and umbilical pain. The pain did not change or radiate. Next, the second template will be for quantitative analysis. The case of quantitative analysis from physical examination. You can see that should be critically in this point case of quantitative analysis about appendicitis physical examination. Here in the template is appendix orientation or physical examination. Rectocecal or rectocolic physical examination of obturator sign and visual sign. Subcecal physical examination of rectal tendonitis, the obturator sign, and vaginal tendonitis in women. Post-ilear or pre-ilear none. Pelvic physical examination of rectal tendonitis, the obturator sign, and vaginal tendonitis in women. peritoneal involvement, physical examination, embryo's point tenderness, abdominal rigidity or guarding, percussive tenderness, rough sign, ribot tenderness or Blumberg sign, and the Mark sign. Most common appendix orientation and the physical examination associated with each type in cause with appendicitis. This cause demonstrates a pre-ileal orientation with the appendix tip located at the epigastric region, which result in epigastric pain. With epigastric pain and 3 episodes of non-bloody emesis less than 4 hours apart, it will be safe to assume some form of virus of gastritis. If the patient had gone to his primary care physician, he would not have had the CT done and the appendicitis would to have been found. Brief explanation of some of the information in the previous point. Conclusion. The conclusion that can be drawn from the data above is that qualitative and quantitative analysis on a medical record is very important because it includes the patient identity and diagnosis. This is my reference. I think my presentation is enough. I hope that it will be beneficial information for you all. Thank you for the occasion and attention. Have a great day.